Hey there, it's Brian Liberty, and in this video I'm going to answer the question, what is catatonia? Ooh, Alright, we're going to get to what catatonia is in just a minute. I just need to go over a quick little thing here, which is that this is not the diagnostic criteria for catatonia. This is just a quick description of what's going on. So this should not be used to diagnose anybody, and if you need a diagnosis, you should be seeing a trained professional for that anyway. Now, if the label of catatonia bothers you in any way, if it doesn't help you in your healing or the healing of a loved one, you don't have to use the label. It's just there to point you towards something that's going on. So if it bothers you, don't worry, drop the label and you'll be fine. Now, what's catatonia? Let's get into it. I have some notes down below just to make sure I'm giving you the right information here. And it's something that's used as a specifier for a number of different disorders when we're talking about mental disorders. A specifier is just something that helps to clarify exactly what is going on. And catatonia in specific has to do with psychomotor features, so the way that your body moves in relation to your psychology. And what it involves is there are 3 or more of the following things, and I gotta read them because there's a lot of them here. So there is stupor, which would be no reaction to your environment. Remember, all of these have to do with your body, your physical movement in your body. So stupor is no reaction to your environment. Catalepsy is rigid posture without reacting to your environment. Waxy flexibility is small but even resistance to positioning. So if somebody were to move your hand, there would be an even resistance against them, no matter how they try to move you. That would be waxy flexibility. Mutism is when there is very little or no verbal responses, and this is not aphasia. Aphasia is an inability to understand speech due to brain damage, so mutism is different from that. Negativism, which is opposition or no response to instructions or external stimuli. Posturing, which is spontaneous and active maintenance of a posture without reacting to your environment. Mannerism, which is odd caricature of normal movements. Stereotypy, which is repetitive, unusual, frequent, non-goal directed movements. Agitation, which is not in reaction to the environment. Grimacing, which is facial contortion. Echolalia, which is copying someone else's speech, and echopraxia, which is copying somebody else's movements. So 3 or more of any of those constitutes catatonia. Something to note about catatonia is that the person who's experiencing it may harm themselves or others when there's a more severe form of catatonia going on. And because there's these rigid and fixed movements, there could be a risk of malnutrition, exhaustion, or hyperpyrexia, which is an extremely high fever. So that's just a quick overview of what catatonia is. You may see it in a number of disorders. If you've experienced catatonia, if you have something to add to this discussion, I'd love to hear it, so please leave it in the comments below. And I hope I've given you a nice human perspective on it, and I thank you for joining me today. Hey, it's Brian Liberty. If you like that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.